Good afternoon. I'm Sophia Thomas, President of the American Association of Nurse Practitioners. On behalf of the AANP, I want to thank you, our nation's NPs, for everything you're doing to combat this COVID-19 crisis every day. You're out there on the front lines, practicing, putting your own life, health, and safety at risk as you care for the patients that so desperately need our care right now. Thank you for everything that you are doing. And to our patients, the ones that are actually staying home, practicing social distancing, and utilizing telehealth services, thank you. Together, we will be able to flatten the curve and combat COVID-19. This week, I have some more good news to share with you on the progress that we're making to advance the policies that support patients during these very challenging times. I am very pleased to report that CMS has taken action to lift barriers at the federal level on a temporary basis so that NPs can expand access to Medicare and Medicaid patients during the COVID-19 crisis. It's very important to note that because NPs must still follow state law, governors must move quickly to ensure NPs in their states can help them address this public health emergency. Some state governors have already taken action to suspend and waive collaboration and supervisory requirements just in this last week. My home state of Louisiana took action just yesterday to suspend all collaborative agreement requirements, and AANP continues to work with policymakers to remove roadblocks to care. To learn more about what action your state has taken, visit the state section in the AANP COVID-19 policy on our webpage. Here are the actions that CMS took just yesterday. CMS took action to immediately authorize nurse practitioners to certify and recertify Medicare and Medicaid patients for home health care services. You heard me say immediately. That's right. Last week, these issues were permanently addressed by the CARES Act that the President signed into law, but under that legislation, CMS had 6 months to finalize rulemaking and work on implementation. So this policy has been expedited so patients can receive home health services immediately. CMS has also waived requirements that hospitalized Medicare patients must be under the care of a physician. This allows hospitals to use nurse practitioners and other healthcare providers at the top of their profession to care for patients in the hospital. And finally, CMS approved expanding the list of services that Medicare will reimburse when provided via telehealth. This will expand NP's ability to perform face-to-face assessments virtually, authorizing some services by telephone, expanding the use of remote patient monitoring and virtual check-ins for new patients, and more. More information about these and other CMS waivers is available on our COVID-19 Resource Center at AANP.org. I encourage all of you to check out this great new news on our webpage. Thank you so much. And I want to thank you for all you're doing every day to fight COVID-19 and care for your patients. Please send us your stories from the front lines by visiting AANP.org. We will continue to carry your message to policymakers and to the media so that together we can beat back the coronavirus. God bless you all. Stay healthy, stay safe, and please practice social distancing. Thank you so much.